I am now going to demonstrate the urine on-site drug screening process. Now, as with alcohol testing, you will be required to present the collector with a signed copy of the consent for drug testing form. In your presence, the collector will complete a chain of custody form. Now, this form is in multiple copies. There is a copy for you, a copy for the collector, a copy for your employer, and if the sample is required to go on to the laboratory for further testing, there will also be a laboratory copy. Now, the sort of information that is captured on this form is your details, the company details, the collector details, information about the testing that is required, the results of the tests will be recorded, and at the end of the process you will be required to sign this form and agree that the information captured and documented on this form is accurately recorded. You will be required to provide a urine specimen and will be provided with a vessel which is sealed when it's handed to you. Once you have opened the seal, then you will be required to provide approximately 1/3 of a beaker of urine. The testing process will be conducted in your presence. Now, I have checked the temperature of this urine in the temperature strip, and the indication is that it is within the range of body temperature. So I am now going to take out of the sealed pouch the screening device, which is a lid. I will now screw the screening device onto the collecting vessel and turn the entire device onto its side. Now you can see the urine is migrating into the bottom of the lid and starting to move up the strips, which are blank to start with. You can see a pink line moving up the strips. The testing process will take approximately 2 to 3 minutes, and what we are looking for is lines turning up all across the C zones, which are the control zones, and where the lines are turning up across the T zone. So we can see the urine now moving up steadily, and you can actually see lines starting to appear. When all the lines are present in the C zone, we can now read whether there are lines in the T zone, which is below the C zone. And in this case, we actually have a line missing in the T zone on the opiate strip. That means that this test is not negative for opiates, and the consequence of that is that we are now required to process the rest of this urine specimen and send it off to the laboratory for confirmatory testing, which takes approximately 3 days to get the results back. Now, the other test that we are carrying out in this lid is at the bottom of the lid you can see some colour boxes. That is where the specimen integrity is being tested for, or whether somebody has tried to beat the test by cheating, such as drinking a lot of fluid prior to the test, taking some agent that's going to theoretically flush the drug out of the system, or adding something to the sample. If any of those practices have been undertaken, then one of those colours will be abnormal. And if a colour is abnormal, that means that the laboratory will be asked to check for the abnormality, and that person will be required to stay around, supervised, until they can provide another specimen, and the second specimen would also be sent to the laboratory for further checking. The results of the tests will be recorded on the chain of custody form. Now this is another sample from another person which we are also running, and you can see the urine starting to migrate up the strips, visualised by the pink colour. Once again, we will be looking for whether lines are going to appear in the C zone, the control zone, and whether lines are going to appear in all of the T zones or the test zones. Now in this case, we have all the lines appearing in the C zone, but we also have all the lines appearing in the T zones. So this sample we interpret as being negative for all of the classes of drugs we are testing for.